You went to bed last night and it was manageable. You woke up this morning and it's screaming. Nothing changed, or did it? If your tinnitus has suddenly spiked and you have no idea why, this video is going to give you some real answers. My name is Dr. Julie Prutsman, founder of Sound Relief, doctor of audiology, and a third-generation hearing care professional. Over the past 2 decades, I've worked with tens of thousands of tinnitus patients, and I can tell you that sudden tinnitus spikes are among the most nerve-wracking and misunderstood experiences people face. Today, I'm going to walk you through the most common reasons tinnitus suddenly gets louder, and more importantly, what you can actually do about it. Because here's the truth. Tinnitus isn't static. For most people, it fluctuates, sometimes dramatically, and when you don't understand why, it can feel scary or beyond frustrating. The goal of this video is to remove the mystery. Once you understand what causes spikes, they become less frightening and far more manageable. Before we dive in, a quick but important note. If your tinnitus is accompanied by sudden hearing loss, serious ear pain, severe dizziness, or severe pressure in the ears, you should seek medical attention right away. These symptoms may indicate a need for immediate attention, such as at your local urgent care center. For everyone else experiencing fluctuations in tinnitus loudness, let's talk about why spikes happen. We live in a stressful world, and stress is one of the biggest triggers for tinnitus spikes. When your body enters a stress response, your nervous system becomes hypersensitive and hyperreactive. The brain starts scanning for threats, and tinnitus often gets caught in that spotlight. The auditory system essentially turns up the gain or volume of tinnitus while under stress. Here's what you can do. When these spikes occur, the goal is to calm the nervous system down and signal to the brain that there is no threat. Simple techniques that activate the body's relaxation response can help reduce the intensity of a tinnitus spike. Slow, diaphragmatic breathing can lower the body's stress response in just a few minutes. Try inhaling slowly through your nose for 4 seconds, holding briefly, and exhaling for 6 seconds like this. Gently tensing and relaxing muscle groups from your shoulders down to your feet can help release physical tension that often accompanies tinnitus spikes. Listening to a guided muscle relaxation sequence before bed could definitely help calm the tinnitus and get you to sleep. Reducing stimulants during stressful periods, like caffeine and other stimulants, can increase nervous system activation and make the auditory system more reactive. Instead, try a walk around the block to change the scenery and clear your mind. Another strategy that helps many people is sound enrichment. Adding gentle background sounds such as soft music, nature sounds, or pink noise. This increases the contrast between tinnitus and quiet, which can help the brain stop fixating on the signal. When the nervous system settles down, the brain often stops amplifying tinnitus, and the spike begins to fade. Sleep plays a critical role in how the brain processes sensory information, including sound. During healthy sleep cycles, the brain helps regulate and filter sensory signals so that unimportant inputs fade into the background. Normally, the brain ignores tinnitus while sleeping, much like it does the steady sound of traffic or the sound of rain. But when sleep quality drops, whether from stress, insomnia, or frequent waking, that filtering system becomes less efficient. The result? Your brain becomes more reactive to internal signals, and tinnitus can suddenly sound much louder and more intrusive, even though nothing has physically changed in the ear. Many people notice this pattern after a poor night of sleep. Tinnitus feels louder, more invasive, and harder to manage the next day. What can you do? Improving sleep quality often helps stabilize tinnitus perception and the entire nervous system's response. So focus on sleep hygiene strategies that support the brain's natural reset process, such as a consistent wind-down routine. Going to bed and waking up at the same time helps regulate the nervous system. Gentle background sounds such as brown noise, nature sounds, or soft music increases the contrast between tinnitus and silence, making it easier for the brain to remain calm. Exposure to phones and tablets late at night can interfere with melatonin production and delay the body's natural sleep cycle. Some patients also benefit from relaxation exercises or guided breathing before bed to calm the nervous system down. The encouraging part is that even small improvements in sleep quality can make tinnitus spikes less intense and easier for the brain to filter out again. Noise exposure is another very common trigger for tinnitus spikes. Many people assume it only happens after extremely loud events, like concerts or explosions. But the truth is that everyday sound exposure can sometimes be enough, especially if your auditory system is already sensitive. Things like concerts or sporting events, power tools or lawn equipment, loud restaurants or crowded bars, extended driving with road noise, or long periods using headphones can all place stress on the auditory system. When the ear is exposed to louder sound than it's comfortable handling, the tiny hair cells in the inner ear can temporarily become fatigued. In audiology, we call this a temporary threshold shift, meaning your hearing sensitivity temporarily changes after the exposure. During that recovery period, the auditory system can become more reactive, and the brain may increase neural activity to compensate for the disrupted input. That increased activity can make tinnitus suddenly spike for hours or even a few days after the noise exposure. The good news is that for most people, these spikes are temporary and improve as the auditory system recovers. The most important step is protecting your ears from excessive noise levels moving forward. If you know you'll be around loud environments, using proper hearing protection like high-quality earplugs can dramatically reduce the stress placed on the auditory system. But there's another important point that many people don't realize. After a noise exposure, it's helpful to give your ears a period of relative quiet, but you generally want to avoid complete silence. When the environment is completely silent, tinnitus often becomes more noticeable because there's nothing else for the brain to process. Instead, gentle background sound, such as soft music, nature sounds, or even a ceiling fan, can help stabilize the auditory system and increase the contrast between the tinnitus and silence. Over time, as the auditory system recovers, the spike usually fades and the tinnitus returns to its baseline level. Another factor that can contribute to tinnitus spikes is changes in medication. Many people are surprised to learn that common medications can affect the auditory system. These medications are sometimes referred to as ototoxic, meaning they can affect hearing, balance, or tinnitus in some individuals. Some of the more commonly discussed categories include certain high-dose antibiotics, especially those administered through an IV, anti-inflammatory medications such as high-dose aspirin or prescription-strength NSAIDs, diuretics, which are often used for blood pressure or fluid balance, some chemotherapy drugs like cisplatin or other life-saving drugs, and in some cases, antidepressants, including certain SSRIs like Prozac. Now, it's important to emphasize that this doesn't mean these medications are unsafe or that people should avoid them. For most individuals, they provide important medical benefits and are taken without any hearing-related side effects. But what we do sometimes see in the clinic is that starting a new medication, changing a dose, or switching prescriptions can temporarily alter how the auditory system behaves. Another interesting situation occurs when patients switch between brand name and generic formulations. Even though the active ingredient is the same, the way the medication is absorbed or processed by the body can vary slightly, and in some sensitive individuals, that can influence tinnitus perception. For some patients, the effect is temporary and settles once the body adjusts. For others, the medication may simply be one of several factors contributing to a spike. What can you do? If you notice that your tinnitus spikes shortly after starting a medication or changing a dose, the best step is to have a conversation with your prescribing physician. Never stop or adjust a medication on your own, especially if it's being used to treat an important health condition. Instead, your prescribing physician can help determine whether the medication might be contributing to the change and whether an adjustment or alternative treatment might be appropriate. Often, simply identifying the timing of the spike helps clarify whether medication may be playing a role or not. For some people, diet can influence tinnitus fluctuations. although this area is often oversimplified online. You'll frequently hear claims that certain foods cause tinnitus, but the reality is more nuanced. What diet can do is influence the body systems that affect the auditory system, including circulation, fluid balance in the inner ear, and nervous system activation. Some of the most commonly reported triggers include caffeine, which can stimulate the nervous system, alcohol, which can alter circulation and blood vessel dilation, high sodium intake, which can influence inner ear fluid balance in susceptible individuals, large spikes in sugar, which can affect blood glucose regulation and energy levels. But here's the critical point. There is no universal tinnitus-free diet. What triggers a spike in one person may have no effect at all in someone else. In fact, some people find that caffeine worsens their tinnitus, while others notice no change at all. Instead of eliminating entire categories of foods, a better approach is to focus on pattern recognition. If you suspect diet may be influencing your tinnitus, try keeping a simple log for a couple of weeks that tracks your meals and beverages, sleep quality, stress levels, and tinnitus intensity. Often a pattern becomes clear when you look at these factors together. For most people, moderation and balance work far better than strict dietary restrictions. Dramatically cutting out foods you enjoy can actually increase stress, which ironically can make tinnitus worse. The goal is to understand your own triggers, not follow someone else's list of forbidden foods. There's an old saying, what you focus on grows. In the case of tinnitus, that's not just philosophy, it's neuroscience. Your brain constantly filters thousands of sensory signals every second. The vast majority of these signals never reach conscious awareness because the brain decides they're not important. Tinnitus becomes a problem when the brain begins to treat the sound as important or threatening. When that happens, the brain's attention networks begin to monitor the signal more closely. The auditory cortex essentially turns up the gain or volume, and the tinnitus becomes even more noticeable. This is why many people notice their tinnitus most when they're in a quiet room, lying in bed at night, or after a stressful day when their attention naturally drifts towards internal sensations. And it's also why constantly checking your tinnitus, rating it, or talking about it all day can unintentionally reinforce the signal. The brain interprets that attention as a sign that the sound matters, and it amplifies it. What you can do? One of the key goals of tinnitus therapy is teaching the brain that the sound is not important. There are several clinically supported ways to do this. Sound enrichment is one of the most effective. Gentle background sounds like nature sounds, music, or a fan give the brain something else to process and increase the contrast between tinnitus and silence. Engaging activities also help. When your attention is absorbed in conversation, work, exercise, or hobbies, the brain naturally deprioritizes the tinnitus signal. And mindfulness techniques can help as well. They change the emotional reaction to tinnitus, which reduces the brain's threat response. Over time, these strategies help the brain reclassify tinnitus as a neutral signal, allowing it to fade into the background. This process is called habituation. It's one of the central goals of tinnitus therapy. One of the most common reasons tinnitus spikes is untreated hearing loss. Sometimes it's overlooked, but often it's simply delayed because many people aren't ready to address their hearing loss yet. They worry about what it means, or they assume it will make them look older. Consequently, when hearing loss goes untreated, the brain receives less sound input from the ears and may compensate by increasing neural activity in the auditory system. That increased activity can make tinnitus more noticeable or louder, especially during times when the brain is already under stress. When hearing loss is present, people often must work much harder to understand speech and environmental sounds. That constant effort places additional strain on the auditory system and the brain's attention networks. Over time, that listening fatigue can make tinnitus spikes more likely. What can you do? The first step is a comprehensive hearing evaluation to determine whether hearing loss may be contributing to the tinnitus. When hearing loss is present, restoring access to sound can help stabilize the auditory system. This may include hearing technology designed to restore missing sound input and prescriptive sound therapy, which provides structured auditory stimulation, or a combination of both. By improving the brain's access to external sounds, these approaches often reduce the need to generate or amplify internal signals like tinnitus. For many patients, addressing hearing loss is one of the most effective ways to reduce the intensity and frequency of tinnitus spikes. Here's the most important takeaway. If your tinnitus suddenly spikes, the first reaction is often fear that something is getting worse. Fortunately, in most cases, a spike is simply your auditory system overreacting to something temporary, like stress, sleep changes, noise exposure, or another trigger we talked about today. Once you start to recognize these patterns, the situation becomes much less frightening and more manageable. Instead of feeling like something mysterious is happening to you, you begin to see that you can be in control. And that shift alone can make spikes feel much more manageable. However, there are a few situations where you should seek medical attention sooner rather than later. As I mentioned before, if your tinnitus spike is accompanied by sudden hearing loss, serious ear pain, severe dizziness, or severe ear pressure, it's important to seek medical attention immediately. If this video helped you make sense of what's happening, give us a like. It helps other people find this information right when they need it most. Also, hit subscribe for evidence-based tinnitus advice without the gimmicks. And I'd love to hear from you. Drop a comment below and tell me what triggered your last tinnitus spike. Sharing your experience might help someone else connect the dots. Thank you for watching, and I'll see you in the next video.